Hi, I'm Dr. Maureen Allem from Skin Renewal, and today we're going to discuss why your botulinum toxin is not lasting long enough. So the most important factor is, what was the original dose that you had with your medical doctor, your aesthetic doctor? And very often, if your botulinum is not lasting 3 to 4 months, it means that you've had a suboptimal dose. So the world standard is 20 units of botulinum for a female, for the glabella, 20 for the horizontal lines in the forehead, and 20 units for around the eyes, 10. Some people even push it up to 24, 12. And for a male who has bigger muscles, it's 30 units, 15 and 15, which makes 30. But very importantly, when you see your aesthetic doctor, the doctor has to decide whether you can take this amount of botulinum, because there are a few reasons where you would decrease the dose. Number one, if you're over 60 and you've got, so as you get older, your muscles become less active, so you don't want to give too many botulinum units because you don't want to get a brow droop. And if you see that your patient has got very strong horizontal lines in the forehead, that's a sure sign that they're using their brows to lift up and that their brows have dropped. So that's another reason why you wouldn't get the optimal dose of 20 units per area. The third reason for around the eyes, if you're starting with malar bags and you're over, I'd say 55, 60, then I'd also go easy on the botulinum, because your eye muscle, your orbicularis muscle, acts as a pump. And our eye area is the first to age. And if you give too much botulinum around the eye, you can get puffy eyes, because when we blink, this actually pushes the fluid around the eye out the eye. So if you relax the orbicularis muscle too much and you're slightly older, you may find that you can get a bit of puffiness because you're not, reducing that fluid or that edema around the eye. So that would be another reason why you wouldn't give 20 units, 10, per area. And then if you do have hooded eyes, and some of the beautiful women do have hooded eyes, it means that you cannot see much of their eyelid. And that's another reason why you wouldn't, give too much botulinum. And you have to have a very experienced doctor to understand how the muscles of the forehead work, so that you don't get that drop, that drop brow. Because people come to us and they want botulinum because they want the chemical brow lift that occurs with botulinum. And there's nothing worse than if you have too heavy brows and then you look exhausted. So that defeats the whole object of getting a chemical brow lift. And for this chemical effect to take place, we need spark plugs, which normally are your vitamins and your minerals, to get this chemical process going. And that happens with over 800 enzymes in the body. To get the enzyme processes going, you need that spark plug. And believe it or not, zinc is one of the spark plugs that is very important for that botulinum to snap that snap area on the muscle, and then relax the muscle so that you're going to get the effect. And why would one have low zinc levels? So very often as you get older, your zinc levels decrease and your stomach acid decreases because, number one, you're not getting enough zinc in your food. Another reason is that the body is very clever. The more stressed you are, the lower your body lowers your stomach acid so that you don't get ulcers. So that's another. So chronic stress can also cause low zinc levels. And then another reason is that you need zinc to make stomach acid. And if you don't have enough zinc, you're not going to make enough stomach acid. And one needs stomach acid. It is a vital part of the digestion system and for nutrient absorption. And then you also need stomach acid to absorb all the vitamins in your diet. Most importantly, the B vitamins. And as I said before, vitamins and minerals are the spark plugs that get the enzymes going all around the body. So very importantly, for botulinum to take properly, you need enough zinc levels. And very often we tell patients start taking zinc 3 or 4 days before they actually come for the treatment, just to ensure that their botulinum takes properly. And how do you recognize whether you could have a zinc deficiency? So very often you get these white marks on your nails, and more often you actually suffer from a skin condition like acne, rosacea, psoriasis, all these skin conditions, because zinc is part of your immune system. Zinc is so important for your immune system. So if you don't have enough zinc levels, your immune system is going to not be the greatest. So that is why zinc is so important. And a big factor is a lot of our population, especially our young ladies and some of the men, are on antidepressants called SSRIs. And the women are also on oral contraceptives. And the functional doctors have found that if you are on these medications, you do not absorb zinc very well. So that's another reason why one should take zinc. And then the third reason is very importantly to know the botulinum particle is a very susceptible particle to any break in the cold chain. So you have to keep that particle at a certain temperature. And if you are not going to a medical clinic where it is completely controlled, where there are thermometers on the fridge to ensure that this botulinum, where you store your botulinum toxin in, if that temperature is not perfect, you will find that the botulinum will deteriorate over time. That's why it's so important to go to a proper professional medical clinic and have your botulinum done. Because, hey, you're spending a lot of money. And why do you want to, go somewhere where they cannot ensure the cold chain for you and you're going to get suboptimal results? So that's a very important factor. And then another important factor is if you are a very fast metabolizer. And very often people who are, exercise a lot, you might find that your botulinum will, wear off much quicker. And then also, like once again, lifestyle. If you smoke, if you drink a lot of alcohol, if you've got gut issues, you're not going to get proper nutrient absorption. And then your botulinum toxin is not going to, work as well. So those are some of the factors that could be around that are causing your botulinum not to take so well.